So this is a very well-designed webinar that is going to target management of primary lung tumors. We're going to cover issues about primary lung cancer, the role of biopsy, how the biopsy, which is probably the most important contribution of interventional radiology in general into the management of cancer. How is biopsy changing management of these patients with primary lung cancer? You probably all have heard the importance of targeted therapies. So right now, biopsy is not just to manage or say this patient has lung cancer, but it's also to tell us what kind of biomarkers, what kind of receptors does the tumor have that will allow optimal management of disease by customized targeted therapies that will address each and every tumor for each and every patient. So this is very exciting to have that part in this session. Then we're going to also have a section that describes evolution of surgery with less invasive techniques, with VATS, robotics, and we will know what are the current results of surgery. We know that the standard of care for years it was a major lobectomy. We're going to know what is new in that. Can we have smaller resections and treat disease without the morbidity of the larger resection? We also have an expert that is going to talk to us about image-guided radiotherapy, SBRT, IMRT. What is the role in that area? Can they treat larger tumors? How do we handle central tumors and so forth? Of course, we're going to talk about early stage primary lung cancer and how it is managed by interventional oncology, and also, of course, oligometastatic disease and how we manage this patient where we have metastasis. Does it make sense to treat patients with multiple tumors with local therapy? That's a key question, and I have a lot of things to tell you about that. That's actually my part. And then we're, of course, going to hear about new concepts in lung cancer, but also in each of these modalities and how to optimize treatment for lung cancer patients.
In this session, we're going to address the T1 renal cancer problem. That's now becoming the bulk of all the renal tumours that are presenting to the MDT. In particular, we want to learn about the renal cancer syndromes, as radiology is heavily involved in the screening of genetic cancer syndromes. Inherited renal cancer syndromes in particular, VHL, Birt-Hogg-Dubé, are becoming a recurring theme, and these patients come back and back through radiology and to interventional radiology for treatment. We're going to learn from one of the leading surgeons in the area about the role of robotic partial nephrectomy and what it brings to the table, and if there's a nice juxtaposition with renal cancer ablation. And in particular, we're going to optimize. We've really got to get now in parallel with the outcomes from surgery through optimized renal cancer ablation, and we're going to learn from the Mayo Clinic group about that in particular.
The session is designed to be extremely interactive, and since I have already done a couple of those, I will tell you that actually it's very exciting, although we're very far apart, but then we're all present to take questions and have debates and great discussions. So I encourage you to have your questions, listen to the lectures, and be ready to chat. That's a great feature that, although we're far apart, allows us to bring each other together and share ideas actually on real time.
Everybody should join the webinar. Feel free to chip in. I really do believe that interventional nurses have got some very relevant questions. Surgeons, oncologists in particular, these are incidental tumours that are often discovered during the course of investigation of other tumours. And of course, interventional radiologists looking to improve technique and practice. So everybody's welcome, all aboard.